Good afternoon, everybody. Once again, you can see that Dr. Campbell and I are practicing good social distancing, and our technical crew are all wearing masks. We're going to take our mask off just to improve audio quality, but we think it's important that we message that is what we all should be doing, is wearing masks and face coverings when out in positions where we can't social distance. So again, thank you all for attending. I do have some numbers to update you with. Currently across Northern Lights facilities, we are taking care of 12 individuals who have tested positive for COVID-19. One of them is at Northern Light Eastern Maine Medical Center. 3 of them are at home with home care and hospice care, and then 8 of them are at Mercy Hospital in Portland. There was a question earlier as to why we only report out Mercy and EMMC's numbers as our hospitals. That is simply because there are no positive patients at any of our other facilities. We would include them had we had any of those. Currently across our enterprises, we have 8 individuals who are under investigation for COVID-19, and we hope that these all turn out negative. Northern Light Lab has tested 7,025 individuals, with 208 of those testing positive. And those of you who have been on the call before have noticed that is an increase, and that is certainly due to the ability of Northern Light Lab to increase its capacity for testing and for Northern Light and its entities to do more testing than we had done before. Earlier in the week, the Maine CDC announced that it expanded testing for COVID-19. This is good news for our communities, and certainly an important step as we cautiously resume activity across our state. As we discussed before, though, this does not mean that anybody who wants a test can have a test, and that is simply due to the availability of the testing kits that we need in order to collect specimens. While we do believe we have great capacity to run tests across the state of Maine, and particularly here at EMMC's and Northern Lights lab, as well as the state lab in Augusta, unfortunately we are limited by the number of swabs that we have and the media that we transport those swabs from the collection site to one of our labs to be run. Because of that, we will continue to have to prioritize testing. And as I mentioned before, we continue to use the algorithm that is aligned with what the CDC's announcement was and is very consistent with what we have been doing over the past few weeks. With that said, as I mentioned before, the following groups remain our top priority for testing. Those patients who are ill enough that they need to be hospitalized, symptomatic healthcare workers, first responders performing direct care, symptomatic people living in congregate living situations like a long-term care facility, shelter, jails, and the like. Patients who present to our emergency room where they have symptoms suggestive of COVID-19, and it would help to determine where they would get placed if they need hospitalization or whether they could go home. And then any additional patients who show symptoms where a test may be beneficial in treatment in their clinical course. We are testing other individuals, certain patients receiving outpatient care, such as those who are scheduled to have time-sensitive, medically necessary and procedures that may generate aerosolized particles that could be unsafe for both our staff members as well as other people within our facilities. We are testing women in labor and patients who are scheduled to have a C-section or have labor induced. And then other individuals who may have been exposed to COVID-19 who live in congregate living situations like I mentioned before. We continue to applaud the fact that we can increase our testing, and we have increased our testing, but that does come with that word of caution. But this is a great benefit to the state and to our individuals in our communities. I did want to briefly talk about elective procedures as we see across the state multiple facilities increasing the number of procedures that they are doing. We are doing this in a very phased approach. One, to make sure that we can continue to do things safely, that we are not bringing in unnecessary risks to our patients and our staff into our facilities. And so right now we are continuing to focus in on those medically necessary and time-sensitive procedures like we have spoken about before. Each day we add to the list as to what it is that we can do in a safe and effective manner. And then we want to make sure that we have processes in place to make sure that we will continue to be a safe place for any patient or individual from the state of Maine to come into one of our facilities, feel comfortable that they are well taken care of, and that we are providing safe and practical care for them. And so we continue to do that. Just briefly, I have a few other things before I turn it over to Dr. Campbell. There has been in the news that the state of Maine has received an allotment of remdesivir from the Department of Health and Human Services, and that is true. The state then distributed that to the 4 major medical centers across the state. We continue to work collaboratively with those partners and with the state of Maine. Currently, that medication is given emergency use. It has not been fully approved by the FDA, and that the suggested use for that is for patients who are severely ill and hospitalized, who are requiring large amounts of oxygen for support or ventilators for breathing support. And so we will continue to monitor that, and we will continue to use that medication as appropriate. And then lastly, I just want to once again just say that while we are out in public, we need to continue practicing good social distancing, remaining at least 6 feet apart when we can. We should be wearing face coverings when we are out in our communities. Why? Because this protects other individuals from us, and as they protect us from them. And then lastly, making sure that we practice good hand hygiene and good control of our surfaces, making sure that we are disinfecting our surfaces that we share with other individuals. And with that, I'll turn it over to Dr. Campbell.
Good afternoon, everyone, and thank you, Dr. Jarvis, for inviting me here to talk to the community about mental health services through Northern Light Health and Northern Light Acadia Hospital. It's certainly been a journey attempting to practice and provide excellent psychiatric care to the community during a pandemic. There's no psychiatric playbook for this, and we've been working very closely with Dr. Jarvis in his role as incident commander, following CDC guidelines and interacting closely with the community and our own staff around how to continue to provide the standard of care that we've always been delivering. I'm very pleased to say that we have not found the need to scale back on any services. Northern Light Acadia Hospital is as available to the community as it has always been. We've been able to do this by carefully protecting patients and staff from COVID infections. In addition to that, we have a long-standing telepsychiatry program that we were able to rapidly, almost overnight, scale up for the entirety of our outpatient services for adults, for children, and for seniors. In addition to that, the president of Northern Light Health, Tim Dentry, has made it a high priority to protect the wellness of the Northern Light Health workforce. And to that end, he asked us for our involvement. We have a service in Acadia Hospital called Healthy Life Resources, and they've developed a remarkable program, what we think is a gold standard program, for protecting the wellness of our workforce. You've all read in the news about the challenges to everyone in the community, ourselves included, when it comes to dealing with the changes from COVID-19. In addition to that, healthcare workers are compounded by coming into a workplace where they're often exposed to the virus and where they're dealing with some very emotionally challenging and heartbreaking situations involving illness in community members. To that end, the work represents a chronic stressor. It's a complex workforce. It's distributed throughout the state. We've used our telehealth platform in order to deliver it, and I'm going to talk a bit about the program that we've established. First of all, we've created a portal that is accessible to all members, all employees in the Northern Light Health community. This is a portal that provides information about wellness. People can take self-assessments regarding anxiety, regarding depression, regarding their use of alcohol and other substances. As of Friday, we've had 216 employees within Northern Light Health utilize this portal. We track satisfaction, and it has a 90% satisfaction rate. So we're very pleased with that. In addition to that, we've established a training program for leaders throughout the system to help them recognize distress in their teammates and help them learn the skills for how to approach them and begin a productive conversation about that. We do this either in person or virtually. And as of Friday, we have trained 770 leaders in the community with these skills. Apart from the individuals, we know that there are teams of healthcare providers that are working in some very difficult environments. Those working in intensive care units, those working in emergency departments, those working in COVID positive units. You've seen that in the news. That's day in and day out. That takes a great toll on people. We've developed an intervention called a crisis debriefing, where we will regularly meet with a team that's been recognized to be under duress at the conclusion of their shift and spend 15 or 20 minutes checking in with the folks, getting a sense for their levels of stress, talking about coping. We've done 29 of these thus far. They are very well received. We're also able to do what's called a critical incident stress debriefing if it's necessary for a large team that's experienced a particularly traumatic event in the workplace. We believe that this program that we've created meets Mr. Dentry standards for having best in class for wellness management of the workforce. As important as personal protective equipment is, psychological protective equipment is equally important. We believe we're providing that. So that's the conclusion of my presentation.
Thank you, Dr. Campbell. We'll now open it up for questions.
Okay, first up on the list is going to be Amy from WERU. Give me 1 second to unmute you, Amy, and you're all set. Amy, are you there? Okay, well, apparently we don't have Amy, but we'll move on. Next on my list is going, oh, Amy, you there?
Yeah, sorry about that. I was trying out a new headset. I'm sorry the mic didn't work properly. My question is for Dr. Jarvis. Have you seen patients that have an article recently in The Guardian called it the trailing form of the disease? It's people who just never seem to fully recover. And if so, how is that treated, and how are people still contagious? Is it just unknown if the symptoms will ever remit for some folks?
So the question was, have we seen individuals who, after having the acute infection with COVID-19, continue to seem to have symptoms that linger, and whether those people are infectious during that time frame? So yes, we have had several individuals who have been sick enough to need to be hospitalized, who then have had a prolonged recovery course after that initial incident. Whether or not they will continue for the long term of continuing to have some kinds of symptoms, that is unknown at this time. I will say that oftentimes those individuals do get a repeat test to see if it appears that they are continued to be infectious. I'm happy to say that when we have declared somebody as being recovered, we are satisfied that they are no longer infectious and that they can go back to the normal course of their lives, as much as what normal means now, meaning practicing good social distancing and all of the rest. Unfortunately, it is not known whether or not those individuals will continue to have long-term consequences of this disease, and it's just too new for us to know that, and that data will continue to come out as we see people who were infected early on, and then people who continue to be infected as the virus is still out there. Thank you.
Thank you. May I ask a follow-up question?
Absolutely.
Okay. Have you known of any patients that have tested positive, had COVID, recovered, maybe tested negative, and then later tested positive again, like they're seeing with the USS Roosevelt?
So the question is have we seen people who tested positive, recovered, and then either had a negative test and then followed up with a positive test, like we've seen in other locations, particularly on the USS Theodore Roosevelt? And the answer to that question is I am not aware of any cases of that within the Northern Light system. And so while there is that possibility, we just haven't seen that, and we will be learning more about that, particularly with what we're seeing with, unfortunately, our sailors.
Okay, thank you very much, Amy. Next, we'll move on to, WGME. You are up. Once I unmute you, I'm having a little trouble with my Hold on one second. For some reason it's having a hard time unmuting you. WGME, let me, I'm sorry, let me try and get back to you. For some reason, it's sticking when I try and unmute you. I'll move on to Penobscot Bay Press. Leslie, if you're ready, let me just see if it'll work, or it's getting a little sticky here. Leslie, I think, yep, there it goes. Huh.
Yes, it told me that I couldn't unmute myself, and then it told me to unmute myself. Dr. Jarvis, I just have one question. You answered my other one. It's my understanding that there were drive-up testing places in Castine and Blue Hill and Stonington, but now those places aren't doing testing anymore, and people have to go to Blue Hill Hospital or Blue Hill Family, whatever it is. And I'm wondering why.
So I can only comment for the Northern Light facilities, and so I know that our drive-by or drive-up swabbing station, I want to be clear, remember those are collection stations,
Right.
the test still gets run someplace else. We did close the one down at Blue Hill, mostly because of staffing issues and utilization, and the fact that the proximity to Maine Coast Hospital allowed us to direct patients to Maine Coast Hospital's facility for collection. There are a couple of other places within Northern Light where we have converted from using a temporary tent-like shelter to a more hardened facility in case we need to continue to do this for the long run. And so it may be that you're not seeing what you've seen on TV with the cars parked out in front of a tent or driving through a tent, such as what we have at Bass Park. But we are still maintaining our capability to be able to do these swabbing stations and do it in a safe manner so that it protects both the individual being swabbed as well as the staff who are doing the swabbing. So thank you for that question.
Well, Seth, Leslie?
Well, I'm a little confused because I was told by somebody at one of the Northern Light facilities on the Blue Hill Peninsula that they're not doing testing anymore, that the drive-up, collection places are not doing it.
So we'll follow up with you afterwards because
Okay.
that is
Great.
certainly not the information that I have, and we can follow up on what that specific issue was. Thank you.
All right, thank you, Leslie. All right, I'm going to try WGME again. Don't know why it doesn't like you. Let me try something else here real quick. WGME, why don't we do this? Why don't we can you do me a favor and type your questions in the text box, and I will get to them next. I don't know why this button isn't working. I'm going to move on to WABI next. Okay, I don't see anybody from WABI on our list. So I'm going to move on to Bob Evans from New Center, Maine. Go ahead, Bob, you're up.
Okay, thank you. Good afternoon, gentlemen. You mentioned the elective surgeries in your opening statement. Will there be new safety workflows, including sufficient PPEs for staff and testing for COVID before the surgeries happen?
So
Dr. Jarvis?
Yeah, it's a great question, Bob. So the question was, do we have certain safety precautions that are put in place when we're doing procedures, and will testing be a part of that? And the answer to both of those is yes. We will continue to always provide the universal precautions that we do day in and day out, long before COVID was even a word we knew. In addition to that, when we have patients that we either suspect of having COVID-19 or do not know whether they have COVID-19, we do use a higher level of personal protective equipment, and we feel that we have adequate supplies for that to protect both our staff and our patients. And then on select individuals, we are doing some testing, as I mentioned before, particularly on those that are undergoing certain procedures that we know may cause aerosolized particles that when floated in the air may contain virus and therefore raise the risk for everyone. And so knowing firsthand that a patient does not have COVID-19 can help limit the amount of personal protective equipment we all need to wear, and also give us that feeling of safety that we are doing everything in a safe and secure manner. In addition to that, we have put in policies and protocols in place in order to make sure that we are keeping our facility as clean as possible. Those are additive beyond what we had already done, and looking at our records, we are known to be safe facilities in that regard, and we'll continue to make sure that we continue to have that safety. Much of those kind of things were kind of done in the background, and many of our patients and visitors really weren't seeing that. I will tell you that in order to make people feel comfortable that this is a safe place, you will probably be seeing a little bit more of that cleaning that has always gone on, but doing it more right in front of you so that you can feel comfortable that yes, indeed, we are putting your safety first, as we always have and always will. Thank you.
And my second question, follow-up on that is, how do you plan to get through the backlog of patients that occurred due to the pandemic?
That is an excellent question, and we do have a team that is working on that, including our PATH system, which is patient access to healthcare safely. And we will continue to work on that particular issue. For myself, I have taken on the responsibility to look at our backlog of immunizations, as it has always been a passion of mine to make sure that our community is well served and our vaccination rates are high. But we will similarly do that with these time-sensitive and medically necessary procedures. And then those other visits that we have delayed, like wellness checks. And so we will have a process in place that we will go through and make sure that we reach out to those individuals who may have missed those important visits or procedures that they needed to have done. Part of our plan will be to looking at extended business hours, whether that be lengthening out our day, both in the morning and in the evenings, as well as working on weekends. We will do what we need to do in order to serve our community. Thank you.
Okay, next up, WABI, I saw them, but now they're gone. There's got to be some gremlins in the system today. So I'm going to move on to TV7. DJ?
This question is for Dr. Campbell.
Thank you for that,
Dr.
TJ.
How are you?
Very well, thank you.
My question, sir, is what should people be looking for among their family members or even colleagues as signs that the anxiety or stress of the situation may be getting to them?
Well, simplest thing is to ask them how they're doing, but not everybody is willing to talk about it or may even be aware of how much they're struggling. You know, the signs of anxiety, foot tapping, restlessness, trouble sleeping, poor appetite, ruminating about negative subjects, fears and things like that, drinking more alcohol than usual, are some of the more common signs that somebody's having a struggle with something.
I wonder if I could follow up on that, because somebody is talking over Dr. Campbell. I'm not sure how it got recorded. Somebody is not being heard. Is there somebody else on the line here or is it just me?
Chris, can you remind people to mute, or can you mute everybody?
I've got everybody muted but myself, you, and TJ, so I'm not sure where that noise is coming from.
I'll track it down. It could well be.
TJ, is it in your office?
It could well be in my. Well, I can't locate it, but we'll keep. I'm just hoping that the recording comes out all right. I'm sure it will. A follow-up to that is, Dr. Campbell, if people do notice some issue with family members or colleagues, should they do something or should they just back away and it's none of their business?
Yeah, that's an excellent question, which is what is a family member to do or a friend when you notice that someone is struggling? Do you leave them with their space and leave them to themselves? I think that a lot of us were brought up to mind our own business when it comes to these, or finding a conversation with a subject like this is more difficult. But it's very important to reach out and ask how someone's doing. You don't have to know what to do. You can ask them, how can I be helpful for you? I've really, it seems to me like you're having a hard time with this. I wanted to let you know this and see if you wanted to talk about it. And just kind of, I always think that the best approach is common sense and an open mind. But yes, by all means, reach out.
So TJ, we can send you a clean copy, by the way, of our audio, which shouldn't have that interference on it, I don't believe.
Thank you. Thank you, Chris.
It'll track down, I believe it was WGME's mic that was on. I have found WGME. If you're there and would like to ask a question. No, I'm still having issues with WGME. Okay, Aaron, why don't we go to you next? Just give me a second to find YouTube.
Okay, great.
Should be all
Thank you
set.
very much. So I understand that just because the Maine CDC is opening its lab stores to far more testing does not mean that Northern Light can collect far more specimens from everyone suspected of COVID-19 because of that limited number of swabs and vials of transport media. So I'm wondering, what would it take for Northern Light to test everyone as outlined in the Maine CDC's recommendations for expanded testing? How many more swabs, how many more vials of transport media for you? Do you have any estimates that you're looking at?
So the question was, is what would we need at Northern Light Lab in order to collect more specimens and either utilize our own lab's analyzer or the analyzers at the state of Maine in order to test more people? And the truth of the matter is that I don't have an actual number for that. If you just start doing the math, there are 1.3 million citizens in the state of Maine. That does not include our visitors and other individuals who are here. Currently, the state's capacity is to do somewhere around 10,000 tests per week. That would take almost a year and a half in order to get, or 2.5 years to get through all of our citizens, and that's clearly not what we are looking for. Which is why, no matter what, even if we had unlimited testing supplies, we still want to do it in a fashion that makes clinical sense and will be useful to our community. Right now, we are looking at every avenue we can to increase the number of swabs and increase the transport media. We are doing that through our contacts with both the Maine CDC and the federal government, as well as with private industry who supply those to us. And we will continue to work in collaboration with all of them in order to increase the amount of testing that we can do. It is good news that we are able to increase and run more tests both at Northern Light Lab as well as at the state lab facility in Augusta, but unfortunately there will always be some amount of limitation simply because it is a large process and supply chain continues to be a concern for us. Thank you for that question.
Okay, and to follow up, so I do understand that Northern Light Laboratory has some extra capacity to increase testing. I believe it's currently running about 1,000 to 2,000 tests per week, but has a max maybe of about 3,000. Are you thinking about using that extra capacity, and if so, for which patient populations?
So we are hopeful that we will not only be able to use that capacity, but that by mid-June we'll actually be able to increase our capacity even more if we were to get yet another analyzer at Northern Light Lab, similar to how the state of Maine has increased their ability to run more tests. When that happens, we will continue to expand out. We would love it if we could test every individual who has symptoms suggestive of COVID-19. That will help us greatly from a community standpoint by knowing what the true prevalence of the disease is out in our community. In addition to that, we do feel that there is some usefulness in testing some asymptomatic individuals for the exact same reason. And that would include, amongst others, our healthcare workers at our facilities, as well as some people out in the population. We also want to help protect our long-term care facilities, their staff, and their residents as well. And so that would be another area that we would look to expand to. Again, all of this is predicated on us making sure that we have the adequate supplies. In order to run those tests, the machine itself is just not good enough. We need to have the things to put in the machine. And so we will utilize our analyzers to the full capability depending on what our capacity is. But I am hopeful that as June approaches and that we get into mid-June, you will start seeing our abilities to test more individuals.
Okay, thank you. So you're not thinking about a specific type of patient yet for what you would
No,
like?
we will do things in a very controlled and phased rollout, similar to what's happening with reopening the economy, with the procedures that we do. Literally, we are looking at this every single day and determining each day what it is that we can do to best serve our communities.
Thank you very much, Aaron. Hey, TJ, I feel bad that your question got walked over. Now that I got the mics muted, do you want to ask that question again and we can give it one more go?
No, I think actually, Chris, that we're good, that the answer to the second question is probably what is relevant.
Okay. All right, very good.
I do appreciate it, though.
Sure. Thank you all. Ran a little bit over, but not too bad. Is everybody all set? If so, I'd like to wrap this up. And again, those of you who have not asked yet for a clean video copy, if you want one, just send a message to me in the text box down in the right-hand corner, and I'll make sure to send you a Dropbox links when it's done. As this is probably running closer to 40 minutes, it might take a little longer to get that to you this afternoon.
Thank you, gentlemen.
Thank you all for.
Thank you all.
Thank you.